Let us go to the phones this morning for our first guest who is standing by. Good morning. You're on KSJE this morning. Thanks for calling in.
Hi, good morning, Scott. This is Jeff Bourgeois.
Hi, Jeff Bourgeois. We're glad that you're with us again this week. Thank you very much for calling in. We kind of wanted to talk with you a little bit about the current conditions at the hospital, and I'm thinking that numbers are certainly lower than they certainly have been a month or so ago, right?
Oh, you bet. They're the lowest, Scott, that they've been in quite a while since way back in October when this second surge started. Today, we actually have only 28 confirmed positive inpatients in the hospital, and as of 6 o'clock this morning, there were 7 additional patients, still pending a test result. So that's very low compared to what we had seen, again in the peak of this second wave last month and the month before. So very encouraged by that downward trend, excuse me, in the need for hospitalization of COVID patients locally.
That's great. And it was my understanding that the 4th and 5th floor were designated COVID floors. Do we have a specific census there? How is the ICU doing?
Okay, Megan, let me get back to a report there. So, yes, the 5th floor was, something that we converted as part of our response to this second wave. We did not need to do that the first go round. Because we were able to handle the COVID census back then on the 4th floor exclusively. So let me get back to another document here, if you would bear with me.
No problem, Jeff. Thank you very much for checking for us.
We let's see. Here we go. Okay, so one thing that hospitals everywhere have continued to see is the how the demand is for non-COVID ICU beds. So we are still seeing quite a bit of that. So that ICU is on our 3rd floor, and I believe as of this morning, all 9 of those beds are full, and that is really something to I think call out and make sure that everyone, here we go, I'm gonna get today's numbers. Everyone pays attention to what their current healthcare needs are and not delay care. So, we still have a higher than average ICU census combined between the two at 18. Now we have 23 beds, so we have capacity. But the non-COVID ICU is full, and often that we're seeing patients who have delayed seeking care coming in with a sicker presentation, if you will, than if they had presented earlier. So, and then Megan, back to your question, our COVID ICU has 9 patients in it, and then on the 4th floor, we have outside of the ICU, we have 20 COVID patients, and then only 5 up on that 5th floor. So greatly reduced census for COVID-specific patients.
Indeed. Well, thank you, Jeff Bourgeois, for finding out that information for us. And I just want our listeners to know that we're going to be visiting with you when conditions warrant. So it won't be maybe every week moving forward, because we're grateful that the numbers are down and that you don't need to be on the show every week, but you're certainly always welcome to call in and be a part of the show. But I just wanted everyone to know that since numbers are coming down, and we're so grateful that we will be speaking with you maybe a bit less and less unless things change dramatically. So we appreciate all your efforts over the last few months, Jeff Bourgeois, very much.
We know that you're going to miss us.
Yeah, well, we are so appreciative of the fact that you have provided this venue for us to keep the community updated. It's been valuable to us, and we appreciate that.
Well, you're welcome.
Did you want to know anything about the monoclonal antibody clinic we have available?
Yes, please.
We did want to ask a little bit about that because there were some changes in some of the criteria, I think, for some of the patients who are eligible for treatment. This is another one of the treatment options for patients who do have COVID-19 positive test results, right?
That's right. And it's really interesting. And in a couple of studies that have been done, it has proven to reduce the frequency of or the need for hospitalization, as well as the mortality rate in certain high-risk populations compared to the placebo in these controlled studies. So it's really encouraging, and again, it's for patients that are at risk for having a more severe course of illness than others. So that really includes anybody over age 65. It includes persons between 55 and 64 who have, a long list of underlying health conditions, any one of the following: of a cardiovascular disease, hypertension, COPD or other chronic respiratory disease, a body mass index of greater than 35, that's a measure of obesity, chronic kidney disease, diabetes, or some sort of immunosuppressive disease, or be receiving immunosuppressive therapy. So those patients also qualify. In addition, younger patients from 18 to 54 who have that body mass index greater than 35, chronic kidney disease, diabetes, or the immunosuppressive disease or therapy ongoing, now all qualify. And there are certain other clinical circumstances. The treatment must be within 10 days of onset of symptoms, and that their current course of disease is not requiring hospitalization or oxygen support. It's a one-time outpatient infusion therapy session that lasts approximately an hour. And so we encourage people. We've shared this with our physicians, and then in the community, and then we've shared this with the public via our social media platforms. We also have that news release that we published, I think just yesterday maybe, is now available on our website as well. So it's been really amazing to see how quickly the medical and scientific community has been able to respond to this novel disease that hardly less than a year ago was something we knew anything about. The vaccines being as widely available as they are now, and these types of therapies to help combat people with active course of illness, it's just truly amazing how quickly the scientific, again, and medical community have researched and brought therapies and vaccinations to the general public. So we're happy to be able to participate in that here, and again, encourage people to talk to their physician if they think they may be eligible to receive that type of therapy.
Absolutely. Now let's talk visitor policy. This has been something that I know has been very, very difficult for a lot of people. We saw a press release recently that there's been some changes there. So can you give us an update on that?
Yes, thank you, Megan. And this has been difficult not only for the patients and their family members, but also our caregivers. We truly appreciate the importance of family members and loved ones as part of the healing process. And the circumstances that COVID had created, it was pretty much a universal response by hospitals to have greatly restricted visitor policies throughout this pandemic. So now, as our numbers have subsided, we are now returning to allowing visitors on the non-COVID floor. Still somewhat restricted though. So one visitor per day between the hours of 8 a.m. and 4 p.m. We ask that they be older than 18, and then we still have to do a health screening when they enter the hospital. One of the things that's changed is there are no travel-related restrictions for visitors, but they still have to come in and pass the screening. So, and that's really important for us, as many people have relatives that live out of state and might want to travel to Farmington to visit a hospitalized family member. So that's a change also. We continue to have our no visitor policy for COVID patients, and with exception of rare circumstances on a case-by-case basis where it's felt that for psychosocial reasons or end of life or other circumstances that we do need to allow a visitor. We work closely with the family, physician, and the caregiver team there to consider those requests on a case-by-case basis.
Right. So just to reiterate, the COVID floor is allowing visitors on a case-by-case basis. When it comes to end of life, is it one visitor like per day? Is it just the same visitor the whole period of time? How's that working?
Well, for the COVID floor specifically,
Yes, sir.
yeah, Megan, again, that's entirely a case-by-case circumstance, and it is the rare exception rather than the rule. So, there's not a good answer to or a specific answer to your question. I'm not trying to dodge it, but I'm just, it is truly something we manage on a case-by-case basis and just try to do what is the right thing within the need to protect all involved.
And one more follow-up question. Is
Yeah.
PPE shortage still a thing over there?
No. We've never really had a challenge with PPE thanks to the work our emergency response team had done in acquiring PPE, and as well as just the support we had from the community for donated gowns, et cetera, early on. So we're in good shape. We have an ample supply of reusable gowns, as well as disposable gowns, the N95 masks that our caregivers wear. We have adequate inventory, and eye protection as well.
Very good. So if PPE is not a shortage, then I'm somewhat conflicted on why COVID floor visiting is still as prohibitive as it is. Does PPE is it ever given out to visitors who come in?
Sure, we require them to wear a mask also. It has to do with when a visitor comes to the hospital, although they may screen negative in terms of the screening questions and the temperature check, right? But they still could be an asymptomatic carrier, and oftentimes it's difficult to have full compliance with PPE requirements. For example, when I'm wearing a mask and I need to sneeze or cough, I often want to remove my mask so as to not soil my mask. So it's that reason, and it's also just to protect the individual community member from potential exposure up on the COVID floor, where we know we have a COVID positive patient population. It's really, we believe, erring on the side of caution and using an abundance of caution to protect all involved.
Very good. Well, Jeff Bourgeois, again, we always appreciate your being with us on this program. And again, we will talk with you as conditions warrant moving forward, but we're so glad that numbers are maybe coming down and will stay down there at the hospital. But again, our big thanks to you and the entire staff at San Regional Medical Center, those first responders who are really the front lines of this fight as we see these numbers getting better for our entire community. So once again, thank you very much for joining us this morning.